All right, at this time, we'll call this meeting to order at 8:30. And roll call, I have everyone here but Kathy. We're going to go to approval of the agenda. Do I have a motion to approve the agenda? Virginia, I second. Milty,
I so second.
all in favor, say aye.
Aye.
Anyone
Aye.
oppose? Then any questions on the agenda? Then we'll go to the approval of the February minutes. Do I have a motion, Julie?
There's one correction that should be made. It's on the second page. The PALS program is ran. It should be is run. Are you in?
Do you have that, Deanne?
The PALS program.
Okay. Is there anything else, Julie?
No, that's
Then if there's any other questions, do I have an approval or a motion? Julie? Okay, a second by Milty.
I second. Let's move on.
All in favor, say aye.
Aye.
Oppose? Then we'll move on. Citizen input. Is there anything, Deanne? And there's no citizens here at this time. So we'll move on to Cindy, which is the COVID. So Cindy, I'll let you take over from here.
All right, so COVID update for this month. I believe you guys are all getting the daily report yet, but as of Friday, we had a total of 2,539 positive cases, 11 of which were active. 2,494 had been cleared. We remain at 34 deaths. We've been there for a while, so that's a positive thing. Our active case counts have been coming down in the last month. So we're averaging more like 1 to 2 cases a day versus the 20, 30, 40 that we had seen before Christmas. At this time, we have 1 hospitalization. And then our increase that we're seeing is in younger kids right now. So we're seeing school-age kids as our one group that has jumped the most over the last month. As far as vaccines, we've been pretty busy with those. So our county has done 1,756 first doses and 990 people have completed their second dose for a total of 2,746 doses administered through the county health department. I asked Ross to bring up this screen so that you could see it. This is the state vaccine dashboard, and you can click on any county in the state and it will give you the statistics for vaccines because we are not the only vaccinator here. So within the last month, Algoma Hometown Pharmacy has also begun vaccinating. And then people from our county can go outside of our county limits to receive vaccines as well. So according to this dashboard, 5,523 doses have been administered within Kewaunee County residents. And we're at just about 51% of our 65 plus population that has gotten at least 1 dose. So overall, our county sits at about 17% vaccinated. That's that rainbow like arch at the top. And you see that part of it is orange and part of it is gray. That grayed out part is part of our population that cannot be counted towards vaccine. Those would be the people that are under the age of 16 and cannot receive a vaccination. So they never will right now because it's not approved for their age group.
That's a big chunk of the county. I mean, if that percentage is correct,
Right.
size-wise, yeah.
Right. So it's just about equal to what we've already accomplished in our vaccinating. Yeah.
If somebody's a Kewaunee County resident and gets vaccinated out of the county, do you get that information?
I do not receive that information, but the vaccinator by contract has to put that into the Wisconsin Immunization Registry within 24 hours of receiving that vaccine. Now, we know that's not happening everywhere because some of those big vaccination sites are not putting their data in. And that's why when you look at what we've been allotted as a state, which is about 1.8 million, only 1.7 million of those have been registered into the registry. But we have all of our vaccine registered within 24 hours of receipt. So there are some doses that are probably not quite accounted for, and that might be the people that are going through those large community clinics, such as what Purvey is doing at UWGB and the such. But all of them have to agree to a contract with the immunization registry to become a vaccinator.
On the news this morning, I'm not for sure if it's national news or local news, but they're saying by 2021 or 2022 that students younger than what you say are going to be vaccinated.
Trials are being done right now on children from 12 to 18. To my knowledge, they're not trialing it on any kids younger than 12. But we had heard through the state that even as early as this summer, we may receive vaccine for that age group.
Is that dose as strong as what the adults get?
Sure.
So regarding vaccinations, are all vaccinations, regardless of where you get them, free?
Yes.
Uh,
But
Except for the cocktail one, right?
no, all vaccines are free through the federal government. But what happens is if you receive it through a large healthcare system, so in our area, if you're going to Prevea or Aurora or Bellin, they can charge you for administration of the vaccine, not for the vaccine. So they can charge for their staff time.
I know someone that's in the 65 demographic and they got the cocktail one and they got a bill for $1,300 to their provider.
Should not have happened that way.
So he should kick that back.
Yeah, definitely.
That's Southern Wisconsin.
Yep. All vaccines are free through the federal government. I'm not sure which one that would be.
It's whatever that was supposed to be what Trump got. It's I don't.
Oh, so what they did was that's convalescent IV therapy.
Yeah.
And so, yes, there could be a charge for that.
Okay.
That's not the vaccine. So that's giving people who are COVID positive and fall within certain comorbidities the antibodies through IV to help them fight it off because they're struggling
So
with
that's
that
not free.
disease. Correct.
Okay.
Yes.
Thanks for the clarification.
Yeah.
I have a question. What, it was a child who had COVID. They tested positive and they ended up they went back and had the antibiotics. When they got COVID again, they had a quarantine. Why was that?
Because they tested positive. So their immune system was probably not.
No, they didn't test positive. They tested positive and then they went through their whole thing. They ended up they went for the antibiotic thing or whatever. Then they ended up being with somebody who had COVID and they were told they had in contact and they were told to quarantine again. And the person was like,
yeah, then it was outside of the 90 days of their immunity. So if you tested positive, say last March, and you come in contact with someone now, it's outside of your 90-day range. Your immunity is only set for 90 days following a positive case.
so is this going to keep,
Never ending.
it's never going to end.
That may increase. So they were about to extend that to 180 days when the new variants from England and South Africa hit the United States. So they held back on that because they want to make sure that the vaccines are covering the variants. Because otherwise it's similar to what we see with flu. That's why
Well, I
we
was
do
just
an
gonna
annual
say,
flu
it
shot.
sounds like the flu because I know last year the flu came out and everyone got the flu shot and then it ended up that flu shot wasn't it. It was Blake ended up going in and they were like, oh no, he's not testing for influenza. It's the other strand.
There's dozens of strands of flu.
Right.
And there's dozens of strands of coronavirus.
Yeah.
So you just have to make sure that the vaccine that you're giving is covering the variants that are within the community.
But if another strand comes through, it won't matter on that vaccine, will it?
That's what they're testing right now for, so we don't have that answer.
It's doubtful.
It's doubtful because the flu is never, yeah.
Right now, our vaccine is covering the variant from England. Last week, the South African variant hit Wisconsin. But to my knowledge, I don't know if they've determined whether it's covering the South African variant or not.
There were only a couple of cases in Wisconsin. I don't even think they identified the locale. Has there been an increase in how many people have that South African or South?
To my knowledge, I only know of one case right now. Julie?
Cindy, any thoughts on why the increase in our cases has been in that younger age group?
Well, probably, first of all, we're not seeing that age group vaccinated, and there's still the age group that is within the school systems, within sporting events that congregate a little bit more. I know that other area counties have seen it because kids are doing a lot of things outside of school where they're not social distancing. So the parties are going on and those kind of things, and spring is hitting and everybody just kind of wants to get over it and get out. And I think that we're going to see, that age group affected a bit more right now.
Will you be getting the Johnson & Johnson vaccine also? And
I would expect to have Johnson & Johnson here next week. So with the vaccines right now, we have different tiers that we can vaccinate. And up until this point, we had been working on our tier 1A, which was our frontline healthcare providers, CBRF and nursing home staff and residents, fire, police, rescue, those people. And then we opened it up to the 65 plus. So that is still our main priority group. Last week, they opened up tier 1B, and within it, they've prioritized their priority groups. So within that group right now, we're vaccinating educators and daycare providers first. And the state allotted certain vaccines for educators, but that allotment is not coming out until March 15th, even though they opened up their tiers 2 weeks sooner. So with the vaccine that we got last week, we saw an increase in the number of doses that we received. We took a portion of that, reached out to our schools, both public and private, and said, how many do you need? And then what we asked them to do was to split those groups in half so that we could start working over a 2-week period to get the schools done. We will, by the end of this week, have all educators completed within our county that want to receive that vaccine, both public and parochial. So we're doing very well there. We had a low number of daycare providers that wanted the vaccine. So we will continue to reach out to them, but right now they're not overly accepting of it. So when our additional vaccine, that original allotment the state set aside for educators, comes out on the 15th, that will be Johnson & Johnson. They have taken their full federal allotment and set it aside for educators to get that group done as fast as they can. So we will receive some doses. If we have educators that are left that need a vaccine, we will certainly offer that. And if not, then we will be moving down in our tier groups. So as of this week, the tier group that we're opening up, in addition to the educators and the daycare providers, will be individuals who are on long-term care medical assistance. So that's some of our developmentally disabled people, people that receive those services, such as like our East Shore industry population, that population. So Thursday morning, we are over at East Shore Industries completing the people there that are interested in getting vaccinated. And those are the clients. Their staff have already gotten it. So the week after that, then we can open up to some of our essential workers. And our essential workers that have been prioritized within those groups are utility workers and agriculture and food, frontline food service, but that's not restaurants. That would be like, say, the people working in AgriPure. So if you have food type manufacturing businesses, they will receive it first.
So at what point do you think we're going to be vaccinated in the county with all those that want to be? Because obviously we're not going to be 100% vaccinated because we've got a demographic that doesn't want to be vaccinated.
Correct. I'm hoping by June, we will have the majority of people that are interested in vaccine able to receive that. So I was pulling up a couple of numbers here. We had started out with close to 2,000 people on our waiting list. We're down to 742. And even within that 742, about 175 to 200 of those will come off at the end of this week that have been flagged to receive vaccine. So, we're going to continue to work on that group. And our waiting list is not just 65 plus, it is 65 plus, it's essential workers, it's teachers, it's daycare, it's special needs populations. So we work through that list every single week to see who within the priority or of how those calls came in can receive that vaccine as quickly as possible. We continue to get our reports on our nursing homes and our CBRFs weekly. And when they have positive cases, it's treated differently in the state. So they look at our 2 nursing homes, they look at all nursing homes within the state. And if the case rates go up there, they have to test more frequently. And up probably since October, Kewaunee County's been flagged red, which is not good. So we were at twice a week testing in our nursing home facilities. And we saw other counties go down a little bit quicker. And we are now officially all in the green in Northeast Wisconsin. So that's a positive thing. So we hope to keep that there. But to do that, we have to continue to vaccinate those new residents going into those facilities, because each time you bring in a new resident you come in with a new risk. And the same with their staff. So we're hoping to keep their staff as vaccinated as possible, but they are not required to get it. Overall, our county right now sits, like I said, at the 17%. Of that, 10% have received 2 doses. So those people would be considered, 95% immune. So this week we will continue on the schools. Like I said, our second round of vaccinating for the schools will be on Thursday afternoon, and it's going very well. We're doing everything out of the expo hall, so that's been working very well for us. We had all of our schools agree to come there, which was nice, because with the setup that we have, it's a lot to move if we have to take it down and make it mobile. We will be doing East Shore. We've started a little bit on our grocery workers, the ones that have requested it so far. So grocery stores fall within that essential worker category that is open right now. Eventually we'll move on to the other part that hasn't been addressed yet, is congregate living situations within the county. So we will eventually get to those kind of situations too. Congregate living here would be more of like our Casco community housing, Grandview and Algoma. And even some of our farms may qualify to have congregate living, because if they have a number of people living within housing, in tight quarters that are not related, basically, that's considered congregate living. So we may have some kind of housing situations within ag that would qualify as well. Any other questions on COVID right now? I think we had 1 case over the weekend that I saw come through. So that's still doing okay. We do continue with our contact tracers right now. They have gone down to a couple of days a week. They're splitting out the week. So each of them is taking 2 days and watching over things, and that seems to be working well. And it's freeing up our main staff to go out and do those vaccination clinics, because it takes at least 4 or 5 of us to pull off one of those clinics for sure. All right. That's all I've got on COVID for you.
Any questions? Anybody else? Then we'll move to the reports, and we'll do the February monthly report.
So in front of you, you can see WIC averages remain the same as they have been. Our vaccination numbers are high with 1521. That would include COVID for the month of February. And communicable disease reports remain high. We have 1,282 diseases reported to us. 264 were confirmed. So we still had a fair number of investigations going on with COVID there. And I would say out of the 264, probably 250 were COVID out of that. So we do have a few other diseases coming in. Primarily, we're seeing STDs right now. Anyone have any kind of questions on any of the meetings or activities that took place? Okay.
Then we will move to the agency updates.
Yeah, so I just wanted to fill you in on a few other things that have been taking part in the agency. We continue to offer flu vaccine. We do have a few doses left. Flu activity throughout the state registers very, very low right now. And so I think that people are misinformed thinking that flu is not out there. It is certainly out there, but with the precautions that we have in place for COVID, we're not seeing the normal spread that we typically see person to person because of the social distancing and the masking and the staying home when sick and things like that. So our flu rates are low at this point, but the vaccine is still available. I wanted to mention beaches to you. I did receive word from Wisconsin DNR that our county will continue with about $4,000 for beach testing, which is where we've been at for the last couple of years, which means that they will test Crescent Beach and Selner Beach twice a week from Memorial Day to Labor Day. If you would fail a test, then they continue to test daily till those results are back to normal. But if they're testing good, then it would be twice a week. Those tests will be done by UW Oshkosh under the direction of Greg Kleinheis, which is the lead professor in microbiology there. And he has students that work on it through Manitowoc and Door County. So they have specific housing that they live in both of those counties. And then we kind of fall in between and they cover us as well. Questions on any of the beach testing? All right. I know we had a couple questions on our PALS program last month, and I wanted to let you know that we're going to try to get that up and running for the summer. PALS is our senior exercise program that Jessica is approved to lead. And in addition, they're looking at doing some online virtual kind of PALS and maybe serving some of the younger community members as well. So she'll be taking a class on that in the upcoming weeks to do more education in that physical activity area. Our nutrition and physical activity work group has been getting together regularly, and they just ran a bingo challenge. I don't know if any of you saw that on Facebook, but they had 69 participants, which was pretty good for that. And they offered 20 plus prizes for people that took part in the bingo. So I think they even had like a Packer jersey that they were giving away. Bellin helps us with that and is our lead supporter on that program. So I think you'll see probably another bingo challenge of some sort come out in the next month or so that they're going to work on doing again, because they had some really good participation. But that bingo challenge is focused on wellness and really looks at people doing basic things in nutrition and physical activity and making small life changes, that kind of thing. And then we did get contact from some of our schools that they would like us to pick up on hearing and vision. So we didn't do some of our big public schools in fall as we typically do for the vision and hearing checks because of COVID and the limited number of visitors allowed in schools. But I think they're going to open that up and try to get those kids done before the end of the year to make sure that they receive those services. So we will be working on that as well. we've been pretty fortunate with the students that we receive through Bellin and UWGB. So, so far this semester, we have had Autumn Kohler here, who is our UWGB student. She has helped with all of our vaccination clinics so far. And then starting next week, we have our Bellin student, Jared Christensen, who will be joining us. And he's going to help focus on some of that hearing and vision, as well as the COVID vaccinations, to get those kind of services done.
So that raises a question to me. I know we talked about this some months ago, is with everything being locked down, people weren't getting their wellness testing, and the hearing and vision rekindled that in my thoughts. Are we starting to see a return to that, whether it's being colonoscopies that people are getting, the vision and hearing?
Yeah.
Are all these things coming back now? So
I
these
think
people are
there's-
going to get checked?
Yeah, I think things are slowly starting to improve. I was recently in one of the hospitals, and things are still fairly locked down there, but you can get the services that you need. So the preventative testing and that kind of stuff is now available. The difference is that you can't go in, say, and bring mom. You have to sit in the car and drop her off, which sometimes is difficult to maneuver through, how they have certain parts of the hospitals locked off or unaccessible. Can't sit in a cafeteria yet or anything like that in those kind of facilities. But we are seeing a lot of those preventative services back, and we're going to try to increase it here as much as we can in the upcoming months. I also wanted to let you guys know that I have 2 health hazards that we're investigating. I'm actually dealing with both of them this morning. So they are in apartment buildings here in Kewaunee. One involves bed bugs. The other involves a lot of dog feces. So hopefully we can get those 2 situations cleared up and rectified without having to placard anything. We haven't placard yet. We're having those discussions. And I think that's about all that I have for you. Questions? Oh, I did meet with the fair board as well. That was one last thing that we met this month. They wanted to know if it's going to be feasible to have a county fair. I told them that if they proceed with caution, I think it's reasonable to move forward on their plans. So what I have encouraged from the health department standpoint is to look at methods of adding more hand washing, getting additional volunteers to clean bathrooms, to wipe down tables, to make sure that the eating areas are sanitized, after people stand up and move on. Just trying to get some of the social distancing things out. So, if you're going to have a food stand, get those things on the ground so that people are distancing out, that kind of thing. And hopefully we can make that work so that we have a fair this summer.
Do you know when those dates are?
No.
I have them. I can tell them to you after. Julie, someone important. All right. Any other questions on that? Then we're going to move to the financial report.
All right, so this is January's financial report. So this is the start of all of our grants for the year. I really have nothing significant to tell you on this one. We're working through using our grants. It's a little bit more challenging right now because of the COVID money that is coming in, but we're going to work on spending down every grant dollar that we receive. So we're spending very little county tax levy dollar right now. The tax levy money primarily is probably my salary, more so because I can't be paid by the grants in that regard.
Any other questions on the financial? Then we will move to overtime report.
I really have nothing much to tell you. Our contact tracers on the weekends are working very limited hours. Sydney Helston is our college student who has been doing a lot of that contact tracing on the weekend. And she's averaging probably 2, maybe 3 hours on a Saturday, and that's about it. The rest of my staff, the overtime that's coming in right now is serving for vaccine clinics. And we have minimal of that as well. We do with the schools right now have to extend our hours. So we're vaccinating till 6:30, 7 o'clock at night to get those teachers done after school. But other than that, it's very minimal.
Any questions? Are you going to keep the college student?
So she graduates in May, and I'm really very sad about that because she's great. Yeah. So she will probably be leaving us sometime after May. I do have an opportunity through AHEC, which is our Community Allied Health Connection in Northeast Wisconsin, to hire on another student. The cost is about $2,500 for the summer, and they will work on specific activities for us, mainly our community health improvement plan, which has now kind of fallen behind by 2 years because they've given us a little leeway on that. But one of the things that if we would take on an AHEC student is they could gather the information that we need for statistics as far as where we're at in certain areas of health based on, overall state estimates and stuff like that. So that is one thing that we're looking at in the next couple of weeks is maybe signing on to one of those students for the summer. But yeah, I think we're going to lose Sydney, so I'm a little sad.
Sydney was going into nursing? Or-
Yeah, so she'll graduate as an RN in May, and she's actually from Florida, so she might be venturing south of here too. I wouldn't blame her, but yeah.
Okay. Then we'll move to next meeting date. We normally, don't we do the second Monday, which falls on the 12th of April? Is that okay, or did you want to bump it up to the 5th of April? What's better for it would be after Easter.
Yeah, it would be the day after
Yeah.
Easter.
Mhm.
Yeah.
Stay with the 12th? Okay.
No problems. Unless I'm still looking for me.
We'll give you an extra week and then you can let us know. The 12th, 8:30.
Is there anything at that meeting that you'd like to hear about specifically? I know prior to COVID, we used to bring staff in to do specific updates to programs, and I would be more than happy to have any member of our staff come back and let you know about any of the programming that they're doing. So, if you'd like to hear more about PALS or the nutrition and physical activity work group or, anything that Allie might be working on within the schools, we can certainly bring one of our staff members up
I
here.
think PALS would be good. If you think you are going to get it going, if you're not, then maybe then do nutrition. But if you think it, because you made the comment that you're going to try to do PALS online virtual. So if it's, that you think it's going to be going, let's try PALS. Because I think that was a good program, but it kind of got halted
Yeah.
very fast.
Okay.
And I think that's great for the senior citizens
We'll
in our
try to do
county.
that monthly again then and
Okay.
bring some stuff up.
Anybody else? Any other questions at this time before we adjourn? Then I'll have a motion. If
I'll
someone
move.
has a motion to adjourn. Jeff, a second. Virginia, all in favor, say aye.
Aye.
Oppose?